and it's in the breaking. We come unbound, and it's in the giving. We are found, yeah. You could barely change.
Welcome to A Medicinal Mind, Wisdom and Wellbeing, a podcast dedicated to the telling of authentic stories and the sharing of insightful wisdom, exploring science and spirituality, medicine and Mother Nature. No topic is off limits when it comes to growing our personal understanding and supporting our collective well-being. With your host, Dr. Rob Abbott, a family medicine resident practicing spiritually focused and evolutionarily informed functional medicine, we hope to nourish your being so that you can flourish in whatever the moment has called for you to do.
And I know you tried.
In episode 16 of A Medicinal Mind, Wisdom and Wellbeing, we share a conversation with board-certified family medicine physician, avid runner, and community health visionary, Dr. Josh Emdur. While Josh is certainly passionate about exercise and sharing his joy for running with his patients, his calling and compassionate service to others is most profoundly embedded in his unrelenting desire to improve the patient-doctor relationship and ultimately improve communities most in need. As you will hear in the podcast, Josh comes from a background and family deeply rooted in medicine, but his unique passions have brought him to pursue an alternative approach to engaging and empowering patients. Josh is one of the newest generation of practitioners practicing telemedicine-based direct primary care, a model previously outlined in episode 7 of our podcast with Dr. Spencer Nadolsky. Both Josh and Spencer have partnered with SteadyMD, an organization and platform dedicated to direct primary care and engagement of patients beyond what is possible in a traditional face-to-face medical encounter. In our conversation today, Josh shares much of his background entering the field of family medicine and later pursuing work as a hospitalist in Boulder, Colorado. Josh shares some of his most insightful wisdom regarding the urgent need to transform healthcare delivery and revitalize the doctor-patient relationship. Together, we explore topics such as what does it mean to be in the profession of medicine, and what is a profession in the first place? We then see what are the most unsustainable aspects of our current medical model, and how are Josh and other physicians seeking to change the course of healthcare delivery. Getting personal, we discuss what does a typical day look like for Josh while seeing patients as part of SteadyMD. What can patients expect as part of their partnership in working with Josh? What are the expected benefits as well as the potential downsides? Do you lose anything when seeing patients over telemedicine? Or perhaps, what are the best emerging communication modalities and health education resources that Josh is currently using to communicate and encourage patients to make sustainable lifestyle changes? And lastly, we dig into our desperate need to find space and value in a cramped and overburdened healthcare system. Why it's time to reflect, think, and further explore the personal needs of each patient, so critical, yet remarkably lacking in our current medical model. How can patients add incredible value to their healthcare and decrease total cost by partnering with a direct primary care doctor through membership-based practices? I'm incredibly grateful to Josh and all the visionary physicians and leaders at SteadyMD. As we share in the podcast, healthcare is changing, And perhaps the only choice now is to decide whether you will be swimming with it or against it. Please seek out Josh via the contact information on our podcast page and begin to explore the many avenues that perhaps you can pursue in order to partner with a direct primary care physician seeking to improve your health and the health of your community. Please, if you enjoy the podcast, we would really appreciate it if you could leave a review in iTunes or Apple Podcasts so that more listeners can engage with our mindful message. Thank you, as always, for your support, and we hope you enjoy the show. Dr. Josh, thank you for joining me today on this podcast. I'm so excited to share a conversation with you.
Thanks, Rob. Happy to be here. You're one of my first, and you're one of my podcast debuts. So, thanks for having me on the show, and I hopefully I can give your listeners some, valuable information.
Well, I'm always excited to have sort of new voices and new faces. I feel like that's kind of what my podcast is for. Surely I'll have people that have already made a name for themselves or have this massive audience, but more often than not, I like reaching out to people who have really authentic and interesting messages that otherwise, aren't quite in the limelight of the Mark Hyman world, the Mark Hyman of the world. So I appreciate you coming to share some of your story.
Well, yeah, great. So, for me, I'm 10 years into practice. I've been working as a hospitalist, so just taking care of patients in the hospital setting ever since finishing my family practice residency. And I was really just ready for a big change. And this opportunity came to me to really kind of reinvent the patient-doctor relationship. And when I heard about it, I just knew it was for me. So,
yeah, we were able to get connected through this kind of shared passion for wanting to really revamp healthcare delivery. And, I was able to do a podcast with our mutual friend, Spencer Nadolsky, a few weeks back. And we talked about this new platform, SteadyMD, where they were sort of taking telemedicine and direct primary care and building into this new package and offering a new service to people who were kind of done with the classic primary care model and really wanted to take charge of their health. And I think I got in touch with one of the main medical directors, and he was like, "You have to talk to Josh. He's got a really amazing story, and you guys will really hit it off." And so, would love to maybe kind of start there. You already sort of prefaced a little bit of your background and how you got into this current space, but was really curious. Why did you even begin a career in medicine to start with?
Yeah, so that's kind of an easy place for me to start. I grew up in a medical family. My father's a physician. He's still practicing in San Diego as a pulmonologist. So, I kind of grew up, in the proverbial footsteps where, some of my first memories were following him around the Cleveland Clinic, where I remember one day I was, 1984. So I was like 7 years old. I got lost in the hospital. And I think from that day on, I just was fascinated by, taking care of people and kind of the lifestyle of being a doctor and really what it meant to dedicate your life to a profession.
Yeah, you use that term profession, and it's something that the director at my family practice residency, the family medicine residency, which I'm a part, spent a great deal of time focusing on, in his mind, the difference between an occupation or work and profession, and this concept of, within medicine anyway, of what is a healthcare professional. And I think I find it fascinating, this kind of envisioning this little child kind of lost in the hospital, yet at the same time completely found within a space that you would in your future soon call a training ground and home.
Yeah, no, that's so interesting that you bring that up. I've never really thought about it like that. But, for me, I always understood, my dad's insane work hours. So he's a critical care pulmonologist. And, when he said he had to go in at the middle of the night, like I kind of really respected that because I could tell that's what his passion was. Like he spent all these years in school and training, and when he got that call from the hospital that someone needed to be intubated or someone was really in trouble, it was just in his DNA that as a doctor, he had to go in then, and he had that calling. And I always, like, even from a young age, I really respected that. On the other hand, my brother and I are polar opposites, and not to say my brother didn't respect and appreciate the work that my dad was doing, but on the same token, my brother was always like, well, it kind of stinks that you're having to spend so much time at work. And in this day and age, with what you brought up with healthcare professionals, I agree with you that it is different to be a healthcare professional than it has a different connotation to kind of be kind of in this system where you're labeled a healthcare professional, to be like really kind of a doctor professional where that's your identity and that's who you are.
Yeah, I see it as, no matter what your beliefs are, you can't take off that badge. Whether at home, yes, you can, obviously remove yourself from the hospital setting, but you're always sort of representing what it means to be a doctor or to be any other healthcare professional, in this field. And people, will automatically, for good or for bad, respect you for that work, kind of knowing, the hours and time that you've put into pursuing this career. And recognizing that you are primarily there for their wellness, and we have to recognize that. With there's, I guess, the very famous saying about with great sort of power and comes great responsibility, and I see as we have a responsibility to represent not just ourselves but sort of the profession as a whole, regardless of where we find ourselves. In a hospital or at home.
That's funny that you bring that up. So here in Boulder, I have we have University of Colorado here, which is my alma mater, and part of that of having the university, I do have quite a number of pre-med students come in and shadow me, and the one thing that I always preach to them, kind of foremost, is the responsibility that you really have to take as a physician, because what I always stress is there's lots of ways to make a living out there, but to really want to be a physician and to dedicate your life to the education process and the financial obligations, at the end, really what you're faced with is this massive responsibility of trying to keep your patients healthy, help them when they're sick, and that's a huge deal.
Yeah, and I think it's really becoming even more of a big deal as we start to expand. I see a great positive with the empowered, engaged patient who's reading on the internet about their disease state and wanting to learn how to best cure themselves, or to just live with optimal wellness. And there within all that information is a lot of sort of misinformation and people with agendas that might be to make a living, to make money, to become an icon. And I don't see it as malicious, and I don't see it as what primarily gets people into the healthcare field. But we have to acknowledge that there is just so much out there, and take ownership of the guidance that we give and the counsel that we give to patients to not intentionally lead them potentially astray or down paths that are not ultimately going to be very beneficial. And that's something that we really have to I think to tackle. And it's not about bashing anyone with different credentials after their name, because I'm very much a believer of just a unified a field of healthcare, but recognizing where am I strongest in my education? What do I fundamentally understand, and what was I trained to do, and am I practicing within my means? And if not, can I go find someone? Am I connected to somebody who has a different skill set that can potentially help my patient? And that, I think, is probably the best service you can do to your patient is saying, well, maybe in this situation, I don't quite know. I don't have the resources to help you, but here's someone who I think can, and directing people to the most helpful, most nourishing resources for their wellness.
Yeah, so you bring up a ton of great points, and what I'm doing here at SteadyMD is this is called a direct primary care model of medicine, meaning that in direct primary care, there's a direct financial relationship between the patient and the doctor without the insurance company in the middle. So direct primary care, what it does by being able to partner directly with your doctor is that it improves access. And we live in just such an interesting and amazing age of technology with the internet where anyone with internet connection has access to just so much medical information for the good and the bad. And with that, it, like you were saying, it gives patients, it empowers patients to have, lots of information. But if they don't have access to a medical professional or someone educated to actually help filter their information, it can cause some real problems. And I'm sure you've seen that in your own practice already, Rob.
Yeah, I mean, it's very, like I said, it's none of it's been malicious. It's just been, sort of, a combination of misinformation, and a lot of times it's a lot of financial stress and burden and just anxiety from the patients who are trying things that realistically, yes, might have had some very minor benefit or could have potentially given them a degree of restored wellness, but in the grand scope of things was very nearsighted to the bigger issues. And just, people get in these states of relative desperation, and I think people can inadvertently, physicians and healthcare professionals can inadvertently feed off of that desperation and end up not serving the true interest of their patients. And we have to from both sides sort of take pause and reflect on where are we at right now, and realize that in states of sort of desperation or as a physician kind of coming in, maybe wanting to make a name for yourself or practice in a different way, we have to realize that we might stray from our initial values unintentionally, and always have to be mindful to come back to this middle ground.
Yeah.
So there's intentions on both sides that need to be involved.
And what really gets me is, right now, politically, with like the whole repeal of ACA and healthcare reform, no one really talks about insurance reform. And with that, in our current system, healthcare accounts for 18% of our gross domestic product, which is just totally unsustainable. And healthcare is too expensive. And even if you are fortunate enough to have insurance, you're probably on a high deductible plan like I am, where my family deductible is $6,000. And if I want to make an appointment to see my doctor to discuss something that I read on the internet, I know that, I'll probably have to wait a couple months to get in to see him. I'll get there, I'll have to pay my out-of-pocket deductible and co-pays. And once I even get to see him, he's probably so rushed because he has, a panel of 2,000 to 3,000 patients, and he's spending half his time doing documentation that he doesn't really have time to sit down with me and kind of address, my questions and really critically review, whatever, literature, or whatever readings I may have found on the internet. So what I'm finding with this current model that I'm practicing in with direct primary care, since I'm not having to check boxes for the sake of checking boxes because the insurance companies require this to be done in order to get compensated for a visit, I'm actually able to focus on my patient instead of all the other stuff that the corporate machine has kind of just forced down doctors' throats as, these are the hoops you need to jump through.
Yeah, and I would really love to maybe get a little granular and sort of ask you and just share with the audience, what does a typical day look like for you in seeing patients if you're not checking off the boxes or spending all this time having to search through an electronic health record or navigate billing codes. What does an average day look like for you in terms of seeing patients?
Yeah, so I can say I have a lot more time for research and shared decision making. So with what we do in our platform is we have a messaging app that's completely HIPAA secure, where my patients can reach out to me and send me links, send me articles, and it's asynchronous, meaning that they can send me something. I can't promise that I'll read it right after they send it to me, but when I sit down, I can actually read it and then call them on the phone or start a video conference to actually kind of discuss it. And this stuff doesn't really take a lot of time. It's pretty easy to do. I can read an article, I can reply via text message, say, hey, I agree with this. Maybe listen to this podcast or read this article, and you can just start like a whole stream of really great information where you can have that shared decision making where the clinic model is just not set up for communication like that.
Yeah, I've been thinking about it quite a bit, and I am, as we've kind of discussed off of the show, and as I've discussed with Spencer and other folks in this platform, I recognize there's no way I would be able to practice outside of anything but a sort of direct primary care membership type model, because I recognize the huge need for time outside of the direct patient interaction to really support them and to do research, to compile a treatment plan, a wellness plan specifically for them. And I recognize, in the current model, when you're so strapped for time and all you have in that extra time, in that administrative time, is to document.
Yeah,
all we can give is a cookie cutter. No,
sorry to interrupt, but there's multiple studies that just address that that have shown that doctors spend 50% of their time doing administrative charting and not direct patient care time. I mean, half the time, half of my day working in the hospital is really just doing documentation.
Yeah, and that's terrifying to me in terms of, and I don't think patients, the public fully realizes that sort of that burden of work that's happening, outside of the patient interaction. I'm not blaming anyone, but it's easy for patients to get frustrated. Like, where's the doctor? Where are they coming to see me? And recognizing that, a lot of that outside time is, one, obviously seeing other patients, but two, doing all this documentation. And, when you bring it to the clinic setting as well, there's no way we can expect physicians to give individualized treatment plans to patients because they just don't have the space and time to be able to provide that. And so that's where the model of a drug for a disease or this collection of symptoms equals this pathology. Therefore, let me give you these drugs and these are the tests I should run. We have to have that sort of degree of, I'm using air quotes, efficiency in order to operate to get through the day. But it makes no room for individualization of the patient experience. And to me, that's a huge, huge problem.
Yeah, so a really interesting thing that I read recently was like an article put out by the Brookings Institute. And the title was something like, Why is healthcare the only field that hasn't gained efficiencies by leveraging technology? And I think that's just so interesting because you would think with all this electronic medical records and all the technology that doctors could actually have more time to spend with their patients. But when I really thought about it, the electronic medical records they're like tools that have been created by the insurance companies to accomplish certain goals of documentation to meet certain requirements, whether they're like the paid per performance metrics of, I'm sure you're aware, Rob, of like with diabetics, checking A1C every 3 months to make sure that they're at goal, blood pressure goals, all that kind of stuff. So a typical primary care doctor in an office is so busy having to check all these boxes to make sure that he's meeting all the performance metrics, which albeit are good things, that medical record was never really meant to provide a solution for doctors to be able to provide better care for their patients in a meaningful way. I mean, sure, better care by making sure that they're accomplishing certain goals for chronic disease management, but is that really what's improving the patient experience? And I would argue that's not really where it's at. It's not, people are not numbers. I mean, people, human beings, we need that human connection with our healthcare provider. If I tell one of my diabetic patients who isn't engaged in their health that, oh, your hemoglobin A1C is not at goal, it's 8, they'll leave that visit and be like, well, my hemoglobin A1C is not at goal, but whatever, they aren't going to really make change. But if you can really have a meaningful relationship with that patient and you can attempt to change their lifestyle, that's how you can improve health, on a nationwide community basis. Let me take that back, on a community basis and extend that out into a national level.
Yeah, I completely agree. And I was just sitting here thinking about, you bring up these checklists and things that get put in place, and checking hemoglobin A1Cs and diabetic foot exams and these things for diabetics. And I find it interesting, like, to me, that for most family doctors, those are the least of my worries about them forgetting. They're very good at doing all of those labs, and the fact that we need a checklist and reminder, it is sort of a level of security, so to speak. But those aren't the things I'm worried about them not doing. What if we made checklists to think of like nutritional deficiencies, or did I have a conversation about what their diet it really is like for more than 5 minutes at one of my visits? And what if we made a whole new pay for performance checklist, and obviously wanting to stay within evidence-based guidelines, but sort of thinking about like, what if we made a new checklist that had things that you don't normally do? And I sort of like find that like interesting. Like, let me remind myself of the things that I'm not normally doing, because I don't need the reminder to check the hemoglobin A1C. Realistically, like, why is that a metric? Like, that's like, the physicians across the board are pretty dang efficient and capable of doing those things. So why are we like focusing on the things that are so kind of fundamental?
Yeah, and the thing that we aren't focusing on, and it's the thing that you brought up first, is what it means to be a doctor, what it is to be part of the profession, of a healing profession. It's not checking boxes. It's not doing certain things because an insurance company is requiring it of you. What it really is, it's about that doctor-patient relationship, which is, it's just going down the tubes, pardon a better term, like, as healthcare is getting more and more complex and specialized, and it's, with that complexity, it's just becoming less personalized. And I'm trying to take that back. Yeah,
and I think you're doing, and partnering with the group that's really incredibly passionate about doing so. And we kind of got a little bit into what a day in the life of Dr. Josh looks like, and would love to maybe expand even further in terms of one visit with a patient. What will that encounter look like over the computer?
Yeah,
and then maybe this can lead us into what are the relative pros and cons of a telemedicine interface in terms of developing that personal relationship?
Yeah, so today I had a new patient who found me using Google. He typed in like online doctor and found me. With SteadyMD, my practice is primarily for runners, but as a primary care doctor, I'm more than happy to manage chronic conditions and take care of non-runners as well. So this patient today was not a runner, but he was a 20-something who has really been dealing with some issues. He's had chronic back pain for the past 6 years after an injury that he had when he was lifeguarding, he was having some problems with migraines. So, with this visit, the first part, it's a video conference most of my onboarding visits are at least an hour, but right now, I'm not really watching the clock. I have a lot more time than I had in the hospital. So got to know each other, video chat, got a real detailed past medical history, surgical history, medications, allergies, stuff that typically a medical assistant would take. But in this platform, since it's more personal and I have the time, I'm really kind of diving in there and getting a complete history. And we attempt to get their past medical history, their previous records, so we have those in previous labs. And after getting a history, really the next step is kind of addressing kind of the main reasons for their visit. And the visit today, like I said, some back pain, which is one of the more common things in primary care, and dealing with with migraine prophylaxis. So we were able to address those. I was able to give him a prescription for a medication for prophylaxis, and unfortunately, this patient is really aware of the opioid crisis in this country, and he was expressing to me how dissatisfied he was with the current system, where he's seen multiple doctors for his back pain, where people have just wanted to push opiates on him, which is one thing that in my SteadyMD practice we definitely can't do. So it was really refreshing to have a young patient who is having pain that's decreasing his function, but really wanted to try an alternative approach. So, I gave him some tips, and I'm actually referring him to a physiatrist in his area, which is actually a friend of mine from medical school who I have a lot of respect for, and I know he's done some really great non-operative spine care for some of my patients. He's also a DO like myself, so I'm hoping that he can maybe do some osteopathic manipulation for him. But even after kind of the main part of the visit, I was able to set up using our SteadyMD app. I was able to set up multiple different chat channels for him where we could start just a bunch of different streams on different topics. And a luxury that you have with this setting of virtual care is, when you're in the clinic and you're pressed for time, or even if you aren't pressed for time, sometimes when you're in the room with the patient, you can't really come up with your best ideas for how to treat a problem. So Actually, after the visit ended was really when I was able to bring up, I was able to post to his app, some other, pretty big, pretty great lifestyle suggestions that, I hope he finds valuable and, uses those to really make some changes in his life.
You bring up such a great point. I mean, in this day and age when you're seeing patients, the numbers of patients that some of the family docs at the clinic where I am a resident, I think about like those encounters in the room, and I'm sure there's plenty of situations where and in the moment you can't completely think of everything that you want to provide the patient, and it isn't until later, maybe in another patient encounter, when suddenly a light bulb goes off, like, oh duh, that like article or that resource or those exercises would have really been good for patient X, but now I have some barrier to even being able to get that information to them. And even with sort of the patient portals that are built into some of these EMRs, it's just the barriers to sort of that direct communication and the time that you're able to to give is kind of compromised. And so I think it's just, that's such a real practical moment that I think some of the physicians and anyone in healthcare listening right now probably like, oh yes, I've had that happen to me so many times, and it's so frustrating that I can't kind of have that follow-up or closure / continuation with the patient because of the restraints.
With this patient today, he brought up one thing that at the beginning of the visit, when I was just getting to know him, I didn't really feel comfortable calling him out on, like, for example, I was asking about caffeine intake, and he was saying like, his vice is, a big gulp a day, which is, a very common thing that we hear from our patients. And, when you're first meeting someone, it's kind of hard to say, hey, you shouldn't have a big gulp a day. That's, 400 calories and 40 grams of sugar. But, after the encounter, I was able to kind of give him a checklist of things to work on that he actually has, in his smartphone, that he can look at every day and say, oh, my doctor did say that maybe instead of that big gulp for my caffeine, maybe I should just have a cup of tea or a great, cup of coffee without sugar, and I'm sure you remember this as a med student, as a med student, I kind of was like, really, do I have to say don't smoke? And I had an attending say to me, of course, as a doctor, that's your only chance. That might be the only time someone touches a healthcare, a doctor or use the word healthcare professional has an opportunity to touch that patient to say, hey, this isn't good for you. Maybe you should make a change. And, with the whole lifestyle change model, that's important to just hear this stuff over and over and over again, even if the patient isn't ready and they're in that pre-contemplation stage of lifestyle change. It's good to just, it's so important for patients to just hear that.
Yeah, and I love that point. I know personally in my life, it took for, I'm just throwing out numbers here, but probably the 30th or 40th time for kind of somebody or something, in my life to come up and say, hey, look, you need to slow down. And maybe there's something to yoga and meditating and getting really quiet. And it just took multiple times hearing that till finally, amidst other sort of aspects of my life that really hit home. And I was like, I need to make this change. And we will never know if something we're saying to somebody is the first time they've heard it or the 150th time. And we won't know what time might finally put them over that threshold to say, I'm going to make a change. And so you're right. And on one hand, there's sort of this, this duty, but with that duty as well to be authentic about it and to not just give it sort of lip service, and recognize that really you just will never know where a patient might be at, and maybe it is that 150th time that finally puts it over the the edge, and maybe you can be that person to give that advice.
Yeah, and I like the fact that it's actually in writing because they have it, as a text message, in their app, which I think when we'll see, since this platform's new to me, but I'm hoping that this could actually be more powerful than just that one time. Oh, my doctor told me I shouldn't do this.
It's maybe kind of silly, but I'm just sitting here. You could totally play on this, and your last name is Emdur. I think of it as something that's enduring instead of playing with the word enduring. These enduring tips for wellness, and just having that checklist and constantly reminding people it's sort of this. It is this enduring presence way beyond just the spoken word. It's something that they're carrying around.
Yeah, well,
you could totally play with that.
If you think about it, Rob, the technology is there to just do the push notifications for whatever it is you want to remind your patients for. So, just set up a reminder. Hey, don't do that today, or take your blood pressure today, or so. I think there's lots of really, really neat tools that can be used to help promote lifestyle change and healthy living.
And I know this is kind of a newer platform for you, a newer space, but was curious if in these sort of first few patient encounters and as you've gotten started, how you felt you've been able to connect with your patients, and has there been any detraction from not being sort of physically present with a patient in terms of the bond and the therapeutic relationship?
Yeah, so that is the biggest, that's the biggest critique of this virtual primary care. And there's lots of things that do need an exam, but there's also lots of things that don't. So I'm hoping that with my virtual practice, that the benefit of having direct access to me as their doctor far outweighs the negatives of not having me there in person to physically examine them. So some examples of that, women's well visits, that's something that, I will just have to refer out to, a local gynecologist or primary care doctor. In some ways, I think SteadyMD can work really well for patients who may already have a primary care doctor, but one that they just can't get in to see very easily. It works well with, patients who, maybe just go to urgent cares for convenience, but don't have that medical home to really help orchestrate their care and their health. So in life, I've kind of realized that there's nothing perfect. You have to take the good with the bad. And from my experience so far, I really think I can probably do more good.
Yeah, I think the added value of your service, far outweighs and trumps any of these, kind of, potential cons or downsides that we bring up. And I was just actually thinking about it today. I see SteadyMD and the direct primary care sort of telemedicine relationship potentially working very well with people who want to continue in the traditional primary care model, and perhaps you can partner with a local doc, and so your patient can actually be part of a membership practice and pay membership fees, and as part of that membership, they get one wellness visit at the sort of direct primary care or at the the traditional primary care office, and they can go in and they can receive their immunization if they need it, or receive a pap smear or the well woman visit at that that time, and or maybe they in the agreement they get 2 acute care visits that if they need a strep swab or some sort of service that you're not going to be able to physically do, or even in a direct primary care service that's in person, you may not carry those sort of supplies in a traditional office, but partner with a local physician and who can provide those and build it into whatever membership model that you have. And I mean, some people might say, well, that's kind of micromanaging, and then one doctor feels like they're not engaging. But I feel like collectively, if people agree that they're invested in someone's wellness, and maybe the traditional doctor recognizes that they don't have all the time necessarily, and that you're going to be a team in this relationship, I see that as potentially a way to, like you said, kind of help people get all the services that they realistically need to kind of fill in any potential gaps that get lost if you're just doing sort of a direct primary telemedicine model.
Yeah, I mean, as a family practice resident, I'm sure I'm preaching to the choir when I say, primary care is really the building block for a healthy population. And care is just getting more and more fragmented, that it's hard for even, it's really hard for anyone to be able to navigate the system. And unless they really have an advocate and I'd argue a primary care doctor kind of orchestrating what it is that they actually need once they get into the world of kind of specialty care and hospital care and, expensive procedures. So, with direct primary care, a thing that I hear pretty often is, equating it to concierge practice. Is that something you're familiar with, Rob?
I've heard that term, and I've sort of equated it more with kind of this skimming off the top sort of model of I'll let and bill insurance and then take some more money, and that kind of getting a negative connotation.
Yeah, so my feeling is concierge really belong in hotels, like hotel lobbies, like kind of telling people where they should go.
That's a good point.
Have dinner and get some show tickets. But over the past 15 years, concierge medicine has been equated with the wealthy who are paying more to have a doctor on retainer. Concierge practices come in lots of different flavors where, some, I'd say, I don't know the percentage, but a lot of them still bill insurance companies, but they are able to have a smaller panel of patients. And some do not. And really, with direct primary care, in a way, it's kind of a rebranding of concierge medicine, where the hope is to have a reasonable monthly fee that really anyone can afford. And at the end of the day, paired with a high deductible insurance plan, can actually save everyone money and improve access and provide better care. So I think that's something that is really important to stress to your listeners, that sure, with what I'm doing at SteadyMD is $79 a month, But if you pair that with a high deductible plan, you can actually have a lot more value of having access to a doctor who knows you and understands your lifestyle and your activities than, having, a fancy insurance plan that still has a high deductible where you still don't have great access to your doctor. And with that access comes that personal relationship, which I just feel is so important to keep people healthy. And, a great example of that, I was recently on a panel for a startup week. And it was a panel discussion about companies that are innovating in the healthcare space. And someone brought up, and not to belittle their work, but it was, someone mentioned a company that's redesigning the hospital gown. And, with that gown, it has some features that help decrease incidence of hospital delirium, which is a big problem. But at the end of the day, I view something like that as something that's really just increasing complexity without really fixing the fundamental problem of having a personal relationship with your doctor.
Yeah. Wow. I mean, it sounds like a very kind of sexy idea of this gown that can, I'm sure measure all these interesting parameters, and it sounds really novel and exciting. But at the end of the day, you're right. Is it really serving the interest of the patient? And
the hospital is going to bill the insurance company. Who knows how many hundreds, if not thousands of dollars for that gown? Which, albeit that gown, could be very effective, and sure, it could, decrease mortality with special sensors to, detect sepsis earlier and have puzzles on it to decrease delirium and, have a Velcro closure on the back so your loved one's rear end isn't hanging out when they're walking down the hall. I mean, those are all great things. But in this day and age, we are able to, create and make all these great things, but at the end of the day, someone actually has to pay for them. And right now, society is having to pay for all these added complexities.
Yeah, it's, I'm sitting here thinking, back to the beginning of this conversation, this idea of community, and realizing we all are invested in each other's health. We don't necessarily think about it because money just kind of disappears from our paycheck, but our taxes and things. We are one collective community, one collective nation.
We are
paying for each other's wellness, and we should see that and recognize we have an incentive to decrease that total cost burden. And
that 18% of GDP. I mean, 18%, crazy.
Yeah, it's unfathomable the amount of money that's spent, and we need an operating system that will actually incentivize decreasing costs. And I think direct primary care and this community level engagement is where we have to start. And like you said, not to belittle the gown with all these gadgets, but that's not going to solve that problem. And I'm sitting here, was kind of curious. You have had a lot of history and work at the community level, where you're at and what you've been able to do even while being a hospitalist, and was really curious if you could share some of your work at within your community and at that level, and where you see that going now that you're in kind of a new direct primary care model.
Yeah. So my wife's also a physician, so we are a full-on medical family, and we moved out to Colorado from San Diego. She's a specialist, so it was a little bit harder for her to find a good job fit than for me when we first moved out. So when we came out to Boulder, I'm huge into the mountains and kind of outdoor adventure sports and running. I'm a huge runner, so Boulder was a great fit. I was happy that my wife found such a great place to work. So when I moved out here, I initially was planning on opening up my own primary care practice, but that was back in 2008 when kind of the writing was on the wall. That was right when kind of most primary care practices were being bought by corporations and hospital systems. And right there, I knew that I didn't want to be an outpatient doctor who was employed. And the main reason for that was kind of the lack of autonomy and knowing that you would be kind of beholden to an organization to practice kind of in their model, in their form. So I was, shortly after moving here, I was offered a hospital medicine position, and I had a lot of hospital medicine experience through my residency. So, I took it in 2008. And meanwhile, we had a family. I have a 6-year-old and a 7-year-old, and, a snap of the fingers, and 9 years had passed, and I was, still doing the same hospital medicine job. And I didn't really know, like I said, that job kind of fell into my lap. And meanwhile, as a hospitalist, one of the big advantages of it is, it's exciting work. It's very intellectually stimulating because you're dealing with, the sickest of the sick. And so it can be really satisfying when a patient comes in really sick and you know exactly what to do, and you have, see them walk out of the hospital a couple of days later, like from a life-threatening infection or a heart attack. And another advantage is that it's shift work. So you kind of go in, you do your shift, you clock in, clock out, not literally yet, but I think pretty soon they'll have doctors hitting a time clock. And what's nice is, with the shift work, like it's really intense when you're there, but when you're off shift, you could decompress. But being a doctor and having that identity of being a doctor and living in kind of a smaller town, like Boulder, Colorado is not a small town, but it's not a huge place where, I walk around and my identity is still that of a doctor, where, my friends or people who I've say someone, like I'll go for a trail run and I'll meet up with an acquaintance on the trail, and all of a sudden they're asking me medical questions. I always kind of take that as, some doctors are annoyed when kind of acquaintances or friends reach out to them for advice, but I'm always kind of flattered by it because, again, that's who I am, and I went into this to try to learn and to help people, as cheesy as that sounds. But with this new kind of platform, I feel like I'm able to do that now, but do it officially, where I have a medical record, where I can be like a doctor friend, if you will, for my community. And that community, in the virtual sense, isn't really geographic, but it's people who, want to identify themselves as one of my patients and part of a practice, a primary care practice for runners.
Yeah, I mean, I find it just, I've had this discussion with a few of other sort of individuals on this podcast, is this, idea of, I call it the blessings and the curses of technology. And I see, we have this, I think, and this is just my opinion, this great need, but at the same time, a great lack of true supportive communities. And while, yes, I love and put so much effort into my local community, my church community, kind of in person, I see there's a vast untapped sort of social network and social community, and these sort of virtual communities where we can all connect over shared beliefs and really support each other. And I was kind of blown away by, I've sort of been a part of Spencer Nadolsky's original kind of Facebook group, and seeing the support that was created there, and just thinking about the people that I've been connected with and doing these podcasts and over these shared values that I haven't even met with in person, and it's all been sort of virtual, and it has given me so much energy and inspiration and strength. And I just see that as that is using the power of these virtual communities for so much good, and for people to remove themselves from these isolating islands, feeling like they're so alone, and their pain and their suffering is totally just within their world. And I see that as a great power. And a lot of people, I guess, poo-poo or just put down some of the struggles that can come from interacting in the sort of virtual world. But I see that as just there's so much potential there, and just have seen it work so far in a few of these settings to really help people. And I see that as something that you're going to grow with your patient base as you go forward.
Yeah. So one thing that I thought was interesting was, I've heard some people say, well, I like to go see my doctor. And I was talking to some of my friends about that. And I still don't know many people who actually really enjoy taking time off work to actually go in and see their doctor. But someone said something to me that was really interesting, saying like, well, hey, I bet when Jeff Bezos was starting Amazon, I'm sure someone told him, well, I like to go to the bookstore. And it's really just kind of a changing of mindset. I mean, you're totally right, where your community doesn't, I don't think your community is geographic anymore. We live in a world now where your community can, span the world with technology, and it's hard for people to embrace change, but change is coming. Change is here.
Yes. Yeah, and I think, of all the people I've talked to, people in my generation, they resonate with the direct primary care membership model. Growing up with paying for a monthly fee for Netflix and a monthly fee for XYZ, whatever, and then you describe the idea of the access and the availability and the communication and the sort of the relationship with this physician who you otherwise probably wouldn't see in a traditional setting. I've described that to people in my generation. They're like, that makes perfect sense and is exactly what I would like from a physician. And I see that as being a catalyst. It resonates with so many people. And that's, like you said, that's change happening right now, whether we sort of, realize it or not. And we need sort of champions like yourself to, I think, push that and carry that space forward, recognizing that truly this is, I think, the direction to best help and serve our communities and best help serve our nation as a whole to get out of this, tremendous debt load that we have from these healthcare costs and the burden of healthcare right now.
Yeah, I couldn't agree more. One of the most kind of frustrating examples of inefficiencies in healthcare, happened sometime within the last decade. But Rob, are you familiar with what happened with the cardiologists? Why all the cardiologists end up being employed by the corporate machines?
I'm not entirely sure. I think you're kind of getting at they were the moneymakers for most hospitals, like the cardiac cath labs and things. But curious where you're going with this.
Yeah. So with part of, I think it was part of ACA, where the reimbursement for cardiologists to do nuclear stress tests and echoes in their office was cut by so much that they were losing money on the tests. At the same time, the law allowed hospitals to bill those tests at a much higher rate. So all of a sudden, a nuclear stress test that used to cost $500 if you paid your local cardiologist, if it was done in their office, it was $500. If it was done at the hospital using their kind of facility codes, it would be billed out at $5,000. So
wow.
with
That's crazy.
With this, it drove cardiologists to be employed by hospitals because it made financial sense. And part of that was, the whole idea of pushing doctors into an employed model so they lose their autonomy. And this isn't conspiracy theory. This is what really happened. Google it. But stuff like this happens all the time, and it just makes no sense to me. And as a very value-minded consumer and individual, I got to a point where I just didn't want to be a cog in that machine anymore.
Yeah, I think the Freakonomics guys are probably sitting here it's all about incentives.
It's just all interesting about stuff. Change is going to take some time, but I'm thinking that the current system is totally going to have to break.
I want to honor
and implode before we get real change.
Your evening and your time, and I've been really grateful for you to be on the podcast so far. And perhaps we've been maybe a tad bit sort of negative in the podcast. I potentially have been a little more negative, and would love to kind of end on a very positive note. And would be really curious to hear from in your own words, having been sort of in the traditional system, but also worked with and been a medical educator, what would be sort of your advice or kind of a final words of wisdom for young doctors like myself, or young medical trainees, or anyone wanting to get into medicine? What would you say to those individuals right now?
Yeah, I would say that the healthcare profession is the most rewarding profession there is, as far as being able to go in and really make impacts on other human beings and really be able to help people and help guide them to health. There's not a whole lot of other professions that I can think of where you can really have that effect. So just kind of, as long as you're able to accept that responsibility and that challenge, it just provides such a rewarding career.
It's really refreshing to hear that message, and in an age when I feel like there's more doctors saying, please don't go into medicine. It's just it's a helpless sort of or hopeless kind of space, and to hear that from you, I think it's incredibly encouraging.
But then the next thing to study is to study value, and high value care, and that's 2 years ago. I became the medical director of an observation unit at our hospital, and that was really my mission, was to improve the value, so improving outcomes at a lower cost. And really the core of that is to not order tests that aren't going to change your management. Don't do things just because it's protocol or it's what you do. I mean, do it if it's going to affect your care. And before you order anything, or before you recommend a referral or procedure, just take a minute and think, what is the value in this? And I think if the medical professionals all start thinking this way, on a value-based, what does this test actually cost, and what value are we going to get from that price? It will affect care, and it will change things.
I completely and entirely agree. And my response to people who would say, well, I don't know what that test costs, well, I say, well, let's go figure it out.
Yeah.
And start from there. So, well, Josh, thank you again, like I said, so much for sharing this space. And I'm so hopeful for all the patients that you're going to see, both runners and non-runners, and just really appreciative that you're willing to kind of take a leap of faith and try something new, knowing that in your heart that this is sort of so right for your community and for our nation moving forward. So thank you.
Oh, and Rob, thanks to you, and thank you for going into family medicine. I mean, for the last I checked, family medicine is back on the up, with more medical school graduates matriculating into family medicine residencies. So that's, I'm really happy to hear that. So good for you. I'm fully supportive of your decision to pursue family medicine and try to, have the mission of keeping your community healthy. That's what it's all about.
Well, thank you. And I guess before we finally close, how can people get in touch with you and sort of follow you in terms of your work going forward? Yeah, so
please take some time to check out my website. It's www.steadymd.com/running. You can also find me on Twitter. My handle's SteadyMD Running. I'm pretty available on Facebook, and also SteadyMD Running at Instagram as well. So, part of this new community is really embracing social media. So, it's the modern thing.
It is, and I'm figuring it out just like everybody else. And so, we'll definitely have those links and things in our notes. And yeah, guys, please reach out to Dr. Josh to connect with him and perhaps be a patient. And even if you're not into running, maybe you'll start running. Maybe Josh will convince you from all the joy in his life from being out on the trail. So thanks again, Josh, and hopefully we'll be able to kind of cross paths and physical form at some point in the future.
Yeah, that'd be great, Rob.
A pleasure. So, well, until next time, have a wonderful evening, and I'll talk to you later.
Sounds good. Thanks for having me on.
Thank you for your presence and willingness to receive a new narrative, a passionate perspective, and perhaps a deeper sense of connection with our collective purpose. Please share this podcast with any and all that you believe will benefit from its intention to relieve one's doing and engage one's being. Please share your comments about the conversation on our podcast page and leave a review in iTunes so that the voices in this space can spread to all ears ready to receive it. Music credit goes to Dillingham for their song Vessel. Remain open, stay curious, and forever be love.
You walked on fire, and I know you tried.